You see it now?
Hi,
Good. We
everyone.
good,
Thank you
Chris?
guys for attending. Really excited to share with you. My name's Chris. I'm the owner of Aesthetic Rep Group. We have a lot of attendees on today that are super excited about the peptide side of things. So we're really excited to launch this push patch product to you guys. And I'm going to turn it over to Dr. Roy Korth, and he can go into maybe a little quick overview of his background and then dive into the product.
Yeah, how's everyone doing? Yeah, so we developed Push Patch. I've been in the regenerative space for the past 13 years and have had a lot of experience with peptides. But the issue we have with a lot of the peptides is number one, you have to inject them. A lot of people don't like using needles. But secondarily, and more important, a lot of the peptides have very short half-life. So basically, what that means is, you get a short, they're effective for a short period of time, and we'll go over the half-lives here in a little bit. But some of the peptides, like BPC-157, is a couple hour half-life. Glutathione, 10 to 15 minutes. GHQ copper is the same thing. So the half-life is very short. So unless people are willing to inject themselves multiple times a day, they're simply not as effective. So we bypass that by using iontophoresis, which is a technology that's been around since the 1900s, but we've been able to simplify it and make it smaller. Back when we first started using iontophoresis in my practice, it was like a big TENS unit with wires and was very clunky. Now we have self-contained units. They kind of stick on you like a big Band-Aid. You can put the peptides on the membrane and utilize it, and they're very effective. And people can wear it throughout the day. So all day long, it's like think of it as having an IV without a needle that you can wear all day long. So that's why it's been very effective, and we use it a lot in our practice in regen and with aesthetics. So my goal tonight is to kind of explain how the technology works, show you the benefits of it. And then, of course, at the end, answer any questions that any of you may have about the technology or about the peptides or coenzymes that we use with PushPatch. I'm going to kind of go over just the basics in the beginning. There's two components we use with this. The first of all, if you look there, that's our push patch. That's the iontophoresis patch there. It looks just like that. I actually have one on my elbow right now just for demonstration purposes. So that's what it looks like. Um, but we also recommend using a derma roller device with this. And what that does is iontophoresis, if you use the patch alone, the absorption rate is about 82%. So it will work without the derma roller. But the biggest challenge for iontophoresis is to get past the stratum corneum, which is that outer layer of skin. So if you use a simple derma roller ahead of time, what will happen is you'll create microchannels, and what that does is allows the peptides to get through that stratum outer layer directly through the dermis and into the bloodstream and deeper tissues, and that's the ultimate goal, to have a systemic effect. So, very effective at getting these through. And as I said, the kind of the way you want to look at this is it's kind of using like an IV or an injection without a needle is the simplest way to think of it. I'm going to show a little demo here just so everyone can see it, and then we'll move on from there.
Today, we're going to show you how to utilize the push patch micro needling tool.
Sorry, guys. I'll turn up the I'll turn my volume up a little bit here. Okay.
Also known as the dermo roller. So Ella here is going to get it on her arm. We're going to go up and down, apply slight pressure. Then you're going to change direction and you're going to go sideways. Now we're ready to prep the patch. This cotton part is going to go where we micro needled her arm. Press firmly against the skin and pull the Start tab. Done.
So you can see it's very easy to use. Typically, the first time in the clinic, we'll put it on the patients ourselves, but then after that, we recommend the patients just simply use it at home and they have no issue with that whatsoever.
Today, we're
And basically, what's on these different things is we're going to be talking about we have peptides on the patches and we also have coenzymes. To keep things really simple, peptides are just short chains of amino acids. And the way you want to think of these is they're simply messages that tell cells what to do. That's what peptides are. There's like text messages. Um, but what's cool about peptides is they're very specific in their message. You know, like insulin's a peptide. And when you eat sugar, your body secretes the peptide insulin and tells the body to take that sugar from the bloodstream and put it inside the cells. So they're very specific in their message and they don't have other side effects or affect other things because of that specificity. The different molecules that we have on here is we have NAD. NAD is very popular right now, not only in regen, but in biohacking and beautification. A couple things to keep in mind with NAD though. Number one, NAD has a very short half-life. If you do it via injection or IV, it only lasts about 30 minutes in the plasma. And NAD also, to be very clear, is not orally bioavailable. It will not bypass the gut. So you cannot take NAD orally. Now, there is another supplement, NMN, we'll go over in a little bit, that is orally bioavailable. But I don't want you to confuse NMN for NAD because although they do have some similarities, there's some differences between taking NAD and taking NMN. The big advantages of NAD is it increases your cellular energy production, the ability to basically take fat, carbohydrates, and proteins and convert them into energy or ATP. Activate your sirtuins. It's very neuroprotective. We actually use it in our clinic a lot to treat TBIs and with lots of degenerative types of conditions. It's kind of crazy. If you have a person with Parkinson's and they wear NAD patches, their tremors noticeably decrease because of that taking down the neuroinflammation and that neuroprotection. And it's also very important for DNA repair, which I think fits really good in the med spa space. We have BPC 157. Once again, very short half-life, 4 to 6 hours, depending on what research you read, and even shorter than that in the plasma. I also want to clarify there are a lot of oral forms of BPC out there, but the systemic bioavailability is less than 10%. And I know a lot of people will say, well, doesn't BPC originate in the gut? And the answer is, yeah, that's where it was first discovered. But to have a systemic effect, you got to get the small and large intestine, and it doesn't make it past the gut. The stomach acids break it down. So it would have an effect on the stomach, but if you're trying to get a systemic effect with BPC, you're going to either have to inject it or do it via iontophoresis. The big benefits of BPC is it promotes angiogenesis, collagen production. It's very beneficial for pain or cytokine modulation. Anyone it helps with healing the tight junctions in the gut, helps with leaky gut, nerve healing, tendon, and ligament repair. So a very good peptide for healing. We have another patch that has KPV, which is another tripeptide. Uh, Once again, very short half-life. And you're going to kind of see that's a common story with all these peptides and coenzymes, and that's why we put them on the patches. 30 to 60-minute half-life. And once again, less than 10% orally bioavailable. The majority of it wouldn't get past the gut if you took it in oral form. KPV is very anti-inflammatory, in particular with that NF-κB pathway, which is the main inflammatory pathway that turns on all your cytokines. It's kind of like a switch that gets turned on, in particular people with autoimmune type conditions. KPV does a really good job of modulating and shutting that pathway down, thus shutting down systemic inflammation. Also is very immunomodulatory, balances T cells and macrophage activity, and it stimulates keratinocyte, fibroblast migration, and ECM production. So as you can see, definitely beneficial. Glutathione's another very popular peptide or coenzyme, but once again, less than 10% orally bioavailable, even in liposomal form. Very short half-life, 10 to 15 minutes if you're doing an IV or an injection or orally. And glutathione is the body's main antioxidant. Scavenges free radicals, regenerates other antioxidants, really helps with your phase 2 detoxification with the liver. chelates heavy metals, enhances the function of T cells, natural killer cells, plays a big role in the synthesis of DNA, and is very anti-inflammatory. And then the final peptide we'll talk about that we have on the patches is GHKCU, or the copper peptide. Once again, not orally bioavailable at all, and very short plasma half-life, about 30 minutes. But GHKCU, in particular in this med spa space, is very popular. It helps with collagen synthesis, angiogenesis, modulates nerve growth, reduces pro-inflammatory cytokines, and aids in DNA repair. So as you can see, and I think as you think of all your practices, there's kind of a place where all of these could potentially fit in and be beneficial. Um, what is NAD? So NAD, as I've mentioned, is not a peptide, it's a coenzyme. But the way I want you to think of NAD is it's the battery that makes your cells work and empowers your enzymes. And it's very important because all these peptides, remember the peptides are just signaling molecules, but they have nothing to do with energy or powering the cells. And basically and it also decreases with age. Typically by the time you're 40, your NAD levels are decreased by about 50%, potentially more depending on what you have going on in your life. And that's why your metabolism slows down. You have less energy, less ability to heal, mental fog, all these different things. And I'm sure anyone who's listening to this can testify if they've actually done like a high dose NAD. When you do NAD, I always equate it, it's almost kind of like bioidentical hormones. If you have patients on bioidentical hormones that need it, it's the one thing you can really feel a big difference when you're lacking it and you get it back. You're like, oh my God, how do I live without it? NAD is the same way. If you have a patient that is, in their 40s or older and their NAD levels are deficient and you restore those levels, um, you don't want to say they get addicted because there's no addictive properties to it, but you feel so good you never want to get off, and that's why it's so popular. And you'll notice with all of our peptides, we always include NAD with the mix, with the BPC, with the KPV. And the reason for that is very simple. Remember, the peptides are just the instructions. They tell the cells what to do. But the problem, if the cells don't have the energy to use the signal, it's useless. And that's why some people that will use BPC or KPV, some people say, oh, yeah, it's the best peptide I've ever used. And other people say, well, it really didn't work for me. Well, if they have mitochondrial dysfunction, if their cells don't have the energy to take those instructions and have a function, they're not going to get a result. So we felt as though it was very important to include with all the peptides that NAD to make sure not only do the cells get the signal, but they're actually able to take that signal and do something with it and get the healing action that you're looking to get. I do want to cover NMN a little bit in detail here because I found when we start offering this in our practices, a lot of patients will, the first thing they'll say is, well, I take oral NAD. And there could be oral NAD out there, although it'd be unethical because it's not orally bioavailable, but there is a lot of NMN products out there. And usually what the patient means is they're taking NMN. And yes, NMN does increase intracellular NAD levels, but it doesn't increase extracellular levels. And another thing to consider here is really you're depending upon your body to convert that NMN back into NAD inside the cell. And that can become inefficient and declines with age, which means it's less beneficial. So obviously, when you can do straight NAD, it's going to be much better because as we talked about, the difference between intracellular and extracellular levels. So the NMN increases intracellular ATP levels, which if that conversion happens, basically it's going to help restore ATP, which is energy, help with DNA repair, and activate your sirtuins for longevity. But what you don't get from NMN is any of the extracellular benefits, and these are really important. It's really half the benefits. Number one, the NAD and the extracellular pools support cell-to-cell communication, which is essential. Basically telling the nucleus, basically that communication between the nucleus and the mitochondria, it restores that communication. It helps regulate the immune system, the extracellular pools do, and it also is very anti-inflammatory. So this is the big benefit of taking either IV or iontophoresis NAD over just taking an NMN pill. And then the big area and why the iontophoresis patch is so good is due to these short half-lives. You can see with it, if you're injecting or doing IV drips, you're getting, huge spikes, but they really fall off over time. But where you're using iontophoresis, which you're going to wear this patch for 12 hours, it's going to ramp up and it's going to be a steady state of dosing that whole period of time, which is better for the tissues. And in another example is with NAD. A lot of people, if anyone on here has ever done an NAD IV, it can be number one, it's a 3 hour IV to get 500 milligrams. You're going to get 1300 with the patch. But secondarily, if you do that IV too fast or if you do too much of a sub-Q injection, you just don't feel good. And the reason you don't feel good is the highest concentration of mitochondria, which this stimulates, is in the brain, number one, and the heart, number two. So often you'll feel like a stuffy head or headaches, heart palpitations. It's just because you're overstimulating the mitochondria. You're getting this big spike, and then once again, it's going to be dropping off relatively quickly, anyways. There's an analogy I like to use when I'm talking to patients. We all need NAD to function throughout the day. So let's pretend we're going to go walk around Disney World for 12 hours. And you're going to need water because you're going to be thirsty. Well, if you're doing sub-Q injections, we'll say a standard sub-Q injection would be a 50 milligram injection. That's kind of like if you went to the dentist and he gives you like a little sippy cup of water. It's just not enough. It might quench your thirst for a little bit of time, but after you're walking around the park for an hour or two, you're going to be thirsty again because it just wasn't enough water and it's just not enough NAD. If you do an IV of NAD, it'd be kind of like us saying, let's drink a gallon of water before we hit the park. You're going to hypersaturate your system. If you drink it too fast, you're probably not going to feel that good. But once again, remember, due to that short half-life, it's going to clear your system pretty quickly, and you're going to be 3, 4 hours into Disney and needing more water because the NAD has cleared your system. When you're wearing the iontophoresis patch, it'd be like wearing a camel pack all day long. So your body, you're kind of just sipping on the NAD all day long. Your cells can pull from the pool, your extracellular pools whenever they need it and bring it into the mitochondria. It's just a more efficient way of delivering NAD and all these other peptides. And here's a couple of key comparisons. If you look at that area under the curve, if you're doing daily injections, your exposure, well, if we rated it 100% compared to if you're doing a weekly IV, if you do a weekly IV, you do get 70% more exposure if you do a 500 milligram IV compared to 50 milligram injections. But you can see here, if you just wear one patch a week, you're going to get an additional 276% exposure because you're exposing the tissues for a longer period of time. So there's just a huge difference in the amount of NAD, and this falls through with all the other peptides. Glutathiones are going to even be more pronounced than KPV and BPC because of the short half-life. You're just getting much more tissue exposure, thus a better cellular effect. A couple considerations. These patches, like the one I have on my elbow here, they stick like kinesio tape, if anyone's familiar with that. So it definitely sticks with more adhesive than a standard Band-Aid. The reason we did that is we want people to wear these during athletic events. I have several people that have competed in marathons with these on. You can go to the gym with it on. I put mine on in the morning and I go work out, come home, I get a shower with it on. You can sit in the sauna with it on. It's not going to come off. But that being said, when you take it off, you do want to make sure you get it wet before you take it off. As long as you get it damp before you take it off and pull it off slowly, it comes off very easily. Um, Obviously, you wouldn't want to put it on top of an open wound. And the kits also come with a skin prep pad that we recommend treating the skin with before that protects the skin. If you have people with delicate skin, I personally don't use it, but if you have people that are maybe older with fragile skin, I would recommend using that prep pad and that puts a little layer on top that which helps protect the skin. You don't want to put these patches, they are electric devices. I don't feel it. It's not shocking me or anything. It's very low volt, so it's not like a 10 unit or anything, but it's working. But you don't want to put it on top of metal implants. And you also don't want to put it on top of any other electric devices. So if someone has a pacemaker, don't put the iontophoresis device on top of the pacemaker. If they'd have a pain pump in their back, don't put it on top of the pain pump. You can wear it if you have a pacemaker or a pain pump, just wear it on different locations. If I have a pacemaker here, put it on your shoulder over here. Just don't put it directly on top of any electric device. I'm going to go through some protocols we use in my facilities. With musculoskeletal conditions or neuropathy. And I think in the med spa space, this would be very beneficial if you're doing any procedures that cause a lot of disruption to the skin, maybe like laser procedures or any type of surgery. With BPC, you do want to load, and you'll find that it's that way with most of these peptides. I usually, if someone's in pain, I have them wear the patches 2 or 3 days in a row until the pain decreases. And basically what causes that is remember you're getting that cytokine modulation. It's shutting down those inflammatory cytokines. And then once I get ahead of the pain, I have them wear 2 to 3 patches a week. And remember, if you wear 2 to 3 patches a week of BPC, I think with 2 patches a week of BPC, you're getting 200% more exposure than if you injected the 300 microgram, which is a standard dosage daily of BPC. So you're getting a very high dose, even just wearing 2 BPC patches a week. With traumatic brain injuries or any other type of neurodegenerative conditions, and really the way I do it with all NAD, I tell people if you're going to put NAD into your practice, whether you're going to do IV or iontophoresis patch, you want the patients to feel it. So if someone comes in and says, "Hey, I want to do an NAD IV or wear one patch to try it out," I wouldn't even waste their time because they may or may not feel it. You really want them to load up on it. So I say, listen, you're going to wear the patch 3 days in a row to load it. Why do I want them to do that? Well, I want them to noticeably sleep better. I want them to have more mental clarity. I want them to have more energy. If you wear the patch 3 days in a row, you're going to feel a lot better, more energy, more clarity, and better sleep pattern. Once you get through that first loading phase or 3 days of wearing the patch, then I have them back down for the beginning, the rest of that first month to wearing the patch once a week. So you're going to wear three that first week and then once a week for the balance of the month. And then after that, I have a lot of patients that wear them once a week, and I have a lot of patients that wear them every other week. It's really, once your levels are up, you'll kind of tell when they're starting to decline, and that varies from patient to patient. So I just let them know, hey, listen, when you feel like your energy is starting to decline or your sleep pattern starts to get interrupted again, just put another patch on, and they'll go right back to where they are. Glutathione, that really would depend on the amount of oxidative stress they have in their life. I know a lot of the med spa people because glutathione is very, very good for skin health. It seems like a very common protocol is 2 patches a week for the first month and then one patch a week ongoing. Glutathione in the patch is very effective because once again, a lot of your patients probably already take glutathione orally. Once again, oral bioavailability is not good in the short half-life. 10 to 15 minutes really isn't that effective. And if you're doing it via IV, the same thing is going to apply. Like it's in and out of your system really quickly. And glutathione sub-Q injections typically aren't that comfortable either. So I think a good protocol for glutathione, especially in the med spa space, would be, once again, load them in the beginning, a couple patches a week for that first month, and then after that, you can back it down. KPV, we talked about a little bit in the very beginning. I'm not sure if anyone here really deals with autoimmune conditions, but if you probably have those people in your facilities and just don't know it because maybe you don't talk about it a lot. Anyone that has autoimmune conditions, that NFKB pathway is always turned on, and that's why they have so much systemic inflammation. KPV does an amazing job of shutting that down. If you have anyone with autoimmune conditions and you put them on KPV, you're going to change their life. It's that effective for anyone with autoimmune race related inflammatory issues. As far as pricing, I do want to be clear. This is a medical device. So that means your patients can't buy them directly from us. You can't go on Amazon and buy them. I have seen patches on Amazon that claim they're NAD and BPC and stuff, but there's no drivers to those. You can't put NAD on your skin and expect it to, get into your skin. The same thing with copper. I've seen a lot of copper stickers or patches. There's no way it's going to get past that outer layer of the dermis. So, and although copper is fine to rub on your skin for, I think for topical, if you're trying to have a systemic effect and really build up collagen, you're going to need to either do the iontophoresis or injection. Um, but to be clear, that this is prescription only. So the doctor has to write the prescription, order it from us, and then you would dispense it to the patient, or we can ship to the patient with your prescription. The NAD patch is six. There's 6 treatments per box, and the cost for 6 treatments for the physician's $300, which is really inexpensive when you compare it to an IV. A typical IV is probably going to be 3 to 5 to 600 bucks, depending on what market you're in. And remember, you're getting more exposure with one patch than you are with one 500 milligram IV. So you're getting more exposure, more NAD for less than half the price. BPC, which is something I think you would probably use, obviously, if you have pain or an injury. I think in the med spa space, this would be very beneficial after procedures. This here is 6 treatments in a box, which is $200. That should be adequate if you did like some type of procedure on someone, have them wear a couple days in a row, and then kind of space it out every 2 or 3 days. It would really speed up that healing process. And remember, you're not only getting BPC, you're also getting NAD. So if there's any mitochondrial damage and it helps to use the peptides better, and you're getting 10 milligrams of GHKCU, which will also help recover from these type of treatments. KPV, a box of six is $250. As I said, this is more for autoimmune, which I'm not sure if really appeals to this crowd here. And then glutathione, it's 500 milligrams, and that's also combined with GHKCU because those kind of go hand in hand in that med spa space. And six treatments is only $200, which once again is very inexpensive compared to if you're doing an IV or an injection. Once again, very popular in this space. I do recommend that you have the person get the derma roller. I was told not to call it a microneedling tool. It's a derma roller. Um, but that tool is $5. I do recommend using it, and although not necessary, it will take that efficacy above 82%. And you want them to get as much of the peptides or coenzymes as possible. And obviously, they can keep reusing that same derma roller time after time, just not on different patients. And shipping is $25 on all orders, whether you buy one or you buy a bunch of them. And we ship typically ground, although if there's an emergency situation we need to ship overnight, that's not a problem either. And I know Chris was offering a special. If you guys are willing to place an order by the 11th, he's going to take 10% off your initial order just to try them out. If you're sitting here, listen, the one I would really recommend is if you've never done any of these things and you just want to do a test drive, do NAD. If you do 3 days in a row, you're gonna look back and say, "Man, I can't believe I've never done NAD before." It's just gonna like you have so much more energy. If anyone does any type of cardiovascular or endurance training, your cardiovascular and endurance increase at least 10 to 15%. I can show you where we have people will send back their pulse ox ratios improve. So NAD is really a game changer. Obviously, the other big one would be BPC if anyone here has any type of injuries or recovering from anything. And everyone needs glutathione, although you don't really feel glutathione. Everyone has oxidative stress. So I think that's another really good one. I'm sure you guys have questions for me.
Let's maybe speak to what clinics are charging for these to their patients within, a clinic setting. So typically what you're seeing is that clinics are marking these up 1 to
Typically, they're
1
marking
point.
them up about 100%.
Yeah.
Yeah. And the big recommendation, though, number one, don't sell individual patches because, as I mentioned, the mistake some people make is someone will come in, hey, that sounds really good. Can I try one NAD? Well, they may or may not feel it. What they probably would, they'll probably sleep better that night because it does help with circadian rhythm, but they're not going to get that big energy thing, right? And that's what you want people to feel like amazing during the day. Like, once your NAD levels are up, I work 7, 8, 9, 10 hours a day and I'm still going. I don't even care. And it's different than caffeine. It's not like Adderall. It's not jittery. You just feel very alert and awake. Both of my sons are in nurse practitioner school. They swear it helps them on their tests. So test days they wear patches and they swear it makes them smarter. Um, so if it works for them, I guess it would work for anyone. But I just know in my own situation, just it gets the cobwebs out and you just feel really clear.
Give you guys an idea, the bags that they come in look like this. And then within each bag is 6 patches. You have 6 of the lyophilized vials of product, 6 of the bacteriostatic water that you would mix into the lyophilized vials. Um, and then you have 6 of the cleansing wipes. And then it also comes with 2 of these instruction cards. So complete instructions. So it tells you exactly how to apply, the patch, what to do prior, what to do after, any contraindications, anything like that. So it makes it really easy. A lot of clinics, what they're doing is they're applying the first patch to a patient and then sending them home with the remaining 5 patches, just showing them how to do it themselves. And then they're taking them home and then administering them themselves. So rather than doing a NAD, IV drip 3 hours in your clinic, they can be self-administering and going about their daily routine. So
Yeah,
just wanted to
one thing I
share.
want to add to that, Chris. So
Yep.
those are not cleaning wipes there. Those wipes there are actually the skin pre-treatment.
Sorry.
If
Yeah. Yeah.
someone has sensitive skin, you would use that prior to putting the patch on. And the other thing I would like to add to that too is we do deliver, these are lyophilized. The reason we did that, once you mix any of these peptides or coenzymes, they tend to break down really quickly. So by delivering it lyophilized, you don't have to worry about temperature. You really only have to worry about is direct sunlight. Direct sunlight will break these down, but they come in a black package. They're in amber vials. But you don't want to mix them up until you're going to use them because they do tend to break down pretty quickly. And to guarantee the strength, having a lyophilized and you add the saline to it or the bacteriostatic water to it is going to ensure they're going to get a very potent dose.
There's a couple questions, so I don't know